Hello everybody and welcome to my channel. I'm Mariah and today's topic is Selective Mutism Awareness Month. In this video I will cover everything about selective mutism. This video is research based. For the research in this video, I used one article to gather information for this topic. October is Selective Mutism Awareness Month. The article I read or gathered information from was called Selective Mutism from the NHS website. Selective mutism is a severe anxiety disorder where a person is unable to speak in certain social situations, such as with classmates at school or to relatives they do not see very often. It usually starts during childhood and if left untreated, can persist into adulthood. A child or an adult with selective mutism does not refuse or choose not to speak at certain times. They are literally unable to speak. The expectation to speak to certain people trigger a freeze response with feelings of panic, like a case of bad stage fright, and speaking is impossible. In time, people will learn to anticipate the situations that provoke this distressing reaction and do all they can to avoid it. However, people with selective mutism are able to speak freely to certain people, such as close family and friends, when no one else is around to trigger the freeze response. Selective mutism affects about 1 in 140 young children. It is more common in girls and children who are learning a second language, such as those who've recently migrated from their country of birth. Signs of selective mutism. Selective mutism usually starts in early childhood between the ages of 2 and 4. It often first is noticed when a child starts to interact with people outside their family, such as when they begin nursery or school. The major warning sign is the marked contrast in the child's ability to engage with different people, characterized by sudden stillness and frozen facial expression when they're expected to speak to someone outside their comfort zone. They may avoid eye contact and appear nervous, uneasy, or socially awkward, rude, disinterested, or sulky, clingy, shy, or withdrawn, stiff, tense, or poorly coordinated, stubborn stubborn or aggressive, having temper tantrums when they get home from school, or getting angry when questioned by parents. More confident children with selective mutism can use gestures to communicate. For example, they may nod yes or shake their head no for no. But more severely affected children tend to avoid any form of communication, spoken, written, or gestured. Some children may manage to respond with a few words or may speak in an altered voice, such as a whisper. What causes selective mutism? Experts regard selective mutism as a fear or phobia of speaking to certain people. The cause is not always clear, but it is known to be associated with anxiety. The child usually has a tendency to anxiety and have difficulty taking everyday events in their stride. Many children become too distracted to speak when separated from their parents and transfer this anxiety to the adults who try to settle them. If they have a speech or language disorder or hearing problem, it may make speaking even more stressful. Some children have trouble processing information, such as loud noise or jostling from crowds, a condition known as sensory integration dysfunction. This can make them shut down and be unable to speak when overwhelmed in a busy environment. Again, their anxiety can transfer to other people in that environment. There is no evidence to suggest that children with selective mutism are more likely to have experienced abuse, neglect, or trauma than any other child. When mutism occurs as a symptom of post-traumatic stress disorder, it follows a very different pattern, and the child suddenly stop speaking in environments where they previously had no difficulty. Sorry about that. However, this type of speech withdrawal may lead to selective mutism if the triggers are not addressed and the child develops a more general anxiety about communication. Another misconception is that a child with selective mutism is controlling and manipulative or has autism. There is no relationship between selective mutism and autism, although a child may have both. Diagnosing selective mutism. Left untreated, selective mutism can lead to isolation, low self-esteem, and social anxiety disorder. It can continue in adolescence and adulthood if not managed. Diagnosis in children. A child can successfully overcome selective mutism if it's diagnosed at an early age and appropriately managed. It's important for selective mutism to be recognized early by families and schools so they can work together to reduce anxiety. Staff in early year settings and schools may receive training so they are able to provide appropriate support. If you suspect your child has selective mutism and help is not available, or there are additional concerns, for example, the child struggles to understand instructions or following routines, seek a formal diagnosis from a qualified speech and language therapist. Older children may also need to see a mental health professional or school educational psychologist. A person with selective mutism may not be able to speak during their assessment, but the clinician should be prepared for this and be willing to find another way to communicate. For example, they may encourage the child with selective mutism to communicate through their parents or suggest that older children or adults write down their responses or use a computer. Diagnosis in adults. It's possible for adults to overcome selective mutism, although they may continue to experience the psychological and practical effects of spending years without social interaction or not being able to reach their academic and occupational potential. Adults will ideally be seen by a mental health professional with access to support from a speech and language therapist or another knowledgeable professional. Diagnosis guidelines. Selective mutism is diagnosed according to specific guidelines. These include observations about the person concerned as outlined. They do not speak in specific situations such as during school lessons or when they can be overheard in public. They can speak normally in situations where they feel comfortable, such as when they're alone with their parents at home or an empty classroom, or a bedroom. The inability to speak to certain people has lasted for at least a month, 2 months in a new setting. Associated difficulties. A child with selective mutism will often have other fears and social anxieties, and they may also have additional speech and language difficulties. For example, a child may not do their best in class after seeing other children being asked to read out good work, or they may be afraid to change their routine in case this provokes comments or questions. Many have a general fear of making mistakes. Accidents and urinary infections may result from being unable to actually use a toilet or holding on for hours at a time. I think it means I meant to say holding in. Sorry. School-age children may avoid eating and drinking throughout the day so they do not need to excuse themselves. Teenagers may not develop independence because they are afraid to leave their house unaccompanied. Adults may lack qualifications because they are unable to participate in college life or subsequent interviews. Treating selective mutism. With appropriate handling and treatment, most children are able to overcome selective mutism. But the older they are, when the condition is diagnosed, the longer it will take. The effectiveness of treatment will depend on how long the person has had selective mutism, whether or not they have additional communication or learning difficulties or anxieties. Treatment does not focus on speaking itself, but reducing the anxiety associated with speaking. The need for individual treatment can be avoided if family and staff in early year settings work together to reduce the child's anxiety by creating a positive environment for them. This means not letting the child know you're anxious, reassuring them that they're able to speak when ready, and concentrating on having fun. As well as environmental changes, other older children may need independent support to overcome their anxiety. The most effective types of treatment are cognitive behavioral therapy, or CBT, and behavioral therapy. Cognitive behavioral therapy, which is CBT, helps a person focus on how they think about themselves, the world, and other people, and how their perception of these things affect their thoughts and feelings. CBT also challenges fears and perceptions through graded exposure. CBT is led by mental health professionals and is appropriate for older children and adolescents, particularly those experiencing social anxiety disorder and adults who've grown up with selective mutism. Younger children can also benefit from CBT-based approaches designed to support their general well-being. Behavioral therapy. Behavioral therapy is designed to work towards reinforce desired behaviors while replacing bad behaviors with good ones. Rather than examining a person's past or thoughts, it concentrates on helping combat current difficulties using a gradual step-by-step approach to conquer fears. Stimulus fading. In stimulus fading, the person with selective mutism communicates at ease with someone such as a parent when nobody else is present. Positive and negative reinforcement. Positive and negative reinforcement involves responding favorably to all forms of communication and not adversely encouraging avoidance and silence. Desensitization, I'm sorry if I said that wrong, and desensitization is a technique that involves reducing a person's sensitivity to other people's hearing their voice by sharing voice and video recordings. Shaping. Shaping involves using any technique that enables the person to gradually produce a response that is closer to the desired behavior. Graded exposure. In graded exposure, situations causing the least anxiety are tackled first. With realistic targets and repeated exposure, the anxiety associated with these situations decreases to a manageable level. Older children and adults are encouraged to work out how much anxiety different situations cause, such as answering a phone or asking a stranger the time. Medicine. Medicine is only really appropriate for older children, teenagers, and adults whose anxiety has led to depression or other problems. And advice for parents, and these are some of the things you can do. Don't pressure or bribe your child to encourage them to speak. Let your child know that you understand they're scared to speak and have difficulty speaking at times. Let them take small steps when they feel ready and reassure them that talking will get easier. Do not praise your child publicly for speaking because it can cause embarrassment. Wait until you're alone with them and consider a special treat for their achievement. I hope you enjoyed this video. I'm always open to any suggestions you have for any future video topics. Please let me know what they are in the comment section below or on my Twitter page. And my Twitter handle is @BurleyMariah, and I can spell it for you, @BurleyMariah. The next video might be on Spinal Bifida Awareness Month, Rett Syndrome Awareness Month, or maybe another a different topic that is suggested. And both those awareness months are also in October, so that's why I also wanted to do one of those. I hope everyone's continuing to stay safe. I'll post my notes in the comment section for anyone who needs them. Please like, share, and subscribe if you want to and found this video to be helpful. Feel free to share this video with anyone you think might need it. If you want to be notified for when I do any live streams or upload any new content, you want to click the bell icon, and under the bell icon, you're going to select the all options. Before I sign off, I just wanted to say I'm sorry for any mistakes I made and pronunciation issues, but I always try my best when I'm doing these videos, and I completely understand if you don't like my mistakes and my pronunciation issues in this video, but I leave them in there so you can see that even though I deal with that, I still keep going. Thank you guys for watching. I love you guys. Bye!